Is it normal to have such painful periods that you have to miss schoolwork or cancel plans? If you've ever clutched your stomach and thought, "This can't be normal, you're not alone." Today we're going deep into cramps causes hidden conditions, myths, treatments, and real stories. This might just change your life or the life of someone you love. What is normal period pain? Let's start here. Some discomfort during periods is normal. Mild to moderate cramping, maybe feeling bloated, tired, yes. But when it's intense pain that interferes with daily life, that's something else. Normal has manageable cramps. Abnormal severe pain that requires medication. Affects work, school, causes vomiting, fainting. Signs your period pain isn't normal. 1. Pain that stops you from living normally. If your cramps are so severe that you miss school, work, or daily activities, that's not normal. Normal cramps should be manageable with rest or mild pain relief. 2. Pain that doesn't go away with medication. If over-the-counter meds like ibuprofen or naproxen don't reduce your pain, it might indicate an underlying issue like endometriosis or adenomyosis. 3. Extremely heavy bleeding. Changing pads, tampons every 1-2 hours. Passing large clots or bleeding for more than 7 days is a red flag. This could signal fibroids, hormonal imbalances, or bleeding disorders. Or pain that lasts long before or after period. Cramps are normal during the first 2 to 3 days of your period. But if you feel pain days before your period starts or after it ends, it could be due to chronic pelvic conditions. 5. Pain during sex or bowel movements. Period pain shouldn't make sex or using the bathroom feel painful. If it does, this might indicate endometriosis or pelvic inflammatory disease, PID. Associated symptoms. Severe period pain along with nausea or vomiting, diarrhea, dizziness or fainting, fever, can all point toward more serious conditions. 6. Family history of reproductive disorders. If your mother or sister has endometriosis, Pcos, or other gynecological issues, and your pain is similar, get checked early. What's causing the pain? 1. Primary causes. These are not due to an underlying medical condition, but are still painful. Uterine muscle contractions due to prostaglandins. During menstruation, the uterus contracts to help shed its lining. These contractions are triggered by hormone-like substances called prostaglandins. Higher levels of prostaglandins cause stronger and more painful cramps. This is the most common cause of menstrual pain in teens and young adults. Cramping pain in the lower abdomen or back. Starts before or at the beginning of the period. Improves after the first couple of days. Hormonal imbalance, especially estrogen and progesterone. Hormones regulate your menstrual cycle. If estrogen or progesterone is imbalanced, it can cause heavier bleeding, irregular periods, and more painful cramps. Hormonal imbalance can also affect the sensitivity of the uterine muscles. Common in adolescents. Women with thyroid issues or PCOS. Perimenopausal women. Stress or emotional tension. Stress affects hormone levels, especially cortisol, which can interfere with the balance of reproductive hormones. This may lead to increased muscle tension, intensified cramps, and irregular periods. Results in heightened sensitivity to pain, more emotional discomfort during menstruation, disturbed sleep and digestion. Poor diet or dehydration during menstruation. A diet high in sugar, caffeine, processed foods, and salt can increase inflammation and bloating, making cramps worse. Lack of water can also cause muscles, including the uterus, to cramp more painfully. Secondary causes due to underlying health conditions. These are medical disorders that require diagnosis and treatment. 1. Endometriosis. A condition where tissue similar to the uterine lining grows outside the uterus, on ovaries, fallopian tubes, intestines, etc. Each month, this tissue bleeds like a normal period, but has nowhere to go, causing severe inflammation, pain, and scar tissue. Symptoms: intense cramps, pain during sex, painful bowel movements or urination, infertility, fatigue, fibroids, uterine tumors. These are non-cancerous growths in or around the uterus. They can vary in size and number and may interfere with the uterine. Contractions during menstruation, leading to heavy bleeding and painful cramps. Symptoms: heavy periods, pressure in the lower abdomen, bloating or frequent urination, back pain, adenomyosis, This occurs when the endometrial lining grows into the muscular wall of the uterus, making the uterus larger and heavier. This leads to severe cramping, heavy periods, and chronic pelvic pain. Symptoms: pain that increases with age, painful, heavy, and prolonged periods, tender or enlarged uterus, pelvic inflammatory disease, PID, a bacterial infection, often from untreated, STIs like chlamydia or gonorrhea that affects the uterus, fallopian tubes and ovaries. It causes inflammation, scarring, and pain, especially during menstruation. Symptoms: pelvic or lower abdominal pain, fever, foul-smelling vaginal discharge, pain during intercourse, polycystic ovary syndrome, PCOS, a hormonal disorder where ovaries produce excess androgens, male hormones, leading to irregular periods, cyst formation, and ovulation issues. While not always painful, some women experience cramping and pelvic discomfort. Symptoms: irregular or missed periods, excess hair growth, hirsutism, acne, weight gain, infertility, intrauterine device, IUD. Side effects: some copper or hormonal IUDs can cause increased uterine contractions, especially in the first few months after insertion. This may worsen period pain and bleeding temporarily. Symptoms: stronger cramps during periods, spotting between periods, discomfort during sex in rare cases. What can you do? 1 Natural Remedies. Warm compress or heating pad. Applying heat to your lower abdomen or back helps relax the uterine muscles, improves blood flow, and reduces cramping. How to use: use a hot water bottle or heating pad. Apply for 15-20 minutes at a time. Repeat as needed throughout the day. Bonus tip: a warm bath can also help reduce tension and pain. Ginger tea. Ginger has anti-inflammatory and pain-relieving properties. It reduces prostaglandin levels, which cause cramps, and soothes the uterus. Drink 2-3 times a day during your period. Hydration. Drink warm water. Dehydration can make cramps worse. Warm fluids help increase blood flow and relax the muscles of the uterus. Drink 6 to 8 glasses of water daily. Exercise or gentle yoga. Physical activity helps release endorphins, the body's natural painkillers, and improves blood flow, which reduces cramping. Magnesium-rich foods. Magnesium helps relax muscles and reduce prostaglandin levels, inflammatory chemicals. Banana, nuts, seed, leafy green. Avoid caffeine, sugar, and salty foods. Why avoid? These trigger inflammation, bloating, and water retention, making cramps worse. Sleep and rest. Your body heals and balances hormones better when you're well rested. Poor sleep increases cortisol, which worsens pain. Natural supplements. Use with doctor's advice. Vitamin B6 balances hormones. Vitamin E reduces pain and inflammation. Omega-3 fatty acids reduces period cramps. Zinc, helpful in reducing prostaglandin production. Medical treatments. Bar non-steroidal anti-inflammatory drugs, NSAIDs, reduce prostaglandin production, the main cause of cramps. Relieve pain and inflammation effectively. 2 Hormonal birth control, to regulate or stop periods. Used to reduce menstrual flow and suppress ovulation, which reduces cramps. Combined oral contraceptive pills, COCPs, progesterone-only pills. Hormonal IUD, Adenomyosis, birth control patch, vaginal ring, implant. Also useful for treating underlying causes like endometriosis or adenomyosis. 3 Treating underlying conditions, if diagnosed. If painful periods are due to a secondary cause, treatment is specific to that condition. Or muscle relaxants. Relax uterine and pelvic muscles. Reduce cramping and spasms. Surgery, in rare severe cases. 5 Laparoscopy, to remove endometriosis or fibroids. Top myths about period. Cramps, busted with facts, myth. 1 bar period pain is always normal. Fact. Mild discomfort is normal, but severe cramps that interfere with daily life may indicate conditions like endometriosis, PCOS, or fibroids. Pain should never be ignored if it's debilitating. Myth 2. You can't exercise during periods. Fact. Gentle exercise like walking, stretching, or yoga can actually reduce cramps by increasing blood flow and releasing endorphins, natural painkillers. Myth 3. Only weak girls complain about cramps. Fact: period pain is biological, not emotional. It is caused by uterine muscle contractions and prostaglandins, not weakness or drama. It affects millions of strong women globally. Myth 4: you shouldn't take painkillers. Fact: NSAIDs like ibuprofen or mefenamic acid are medically approved to relieve cramps and are safe when taken as prescribed. Suffering in silence is not necessary. Myth 5: cramps are the same for everyone. Fact: pain varies from person to person. Some have light discomfort. Others face intense pain due to underlying conditions. Comparing pain levels is unfair and unhelpful. Myth 6: teenagers can't have serious period problems. Fact: teens can and do suffer from severe dysmenorrhea, endometriosis, or hormonal disorders. Early diagnosis is key to prevent long-term damage. Myth 7: periods shouldn't affect daily life. Fact: for many women, periods are physically and emotionally exhausting. Workplaces and schools need to be more period-friendly, not dismissive. She thought it was just period pain. Until this happened. Emotional story: women's health awareness. She was late. Not just to school, but late to understand what her body was trying to tell her. Every month, like clockwork, the pain returned. Sharp, crippling, unbearable. But everyone told her the same thing. It's just period cramps. Get over it. The day it broke her. One day, the pain got worse than ever before. She fainted in the bathroom. Her mom broke the door open. She woke up in the hospital, IV in her arm. Confused, scared. The doctor looked at her and said, "This isn't normal period pain. You have endometriosis." The truth about period pain. Turns out, millions of girls and women live in silence, told their pain is normal when it's not. If you miss school, skip work, faint, or vomit from cramps, this is your sign. Something deeper might be going on. The hidden pain no one talks about. Painful periods can be caused by serious conditions like endometriosis, yes, adenomyosis, fibroids, hormonal imbalance. But most girls never get diagnosed. Why? Because we've been taught that pain is normal. It's not. She started treatment. She made changes to her diet, found the right doctor, and finally learned to listen to her body, not society. Today, she's speaking up so that you don't suffer in silence. If your pain is loud, your voice should be louder. Period pain that stops your life is not something you should just deal with. It's not weakness. It's not drama. It's a sign your body needs help, and you deserve to be heard. Talk to a doctor. Share your story. Break the silence. Share this video with your sister, your mom, your daughter, or your best friend, because no one should go through this alone. Comment your story, like if you learned something new. Subscribe for more women's health content. Share this with someone who needs to hear it.